Hey guys, this is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 50 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at fontanelles. Anterior fontanelle, present at birth, typically closes between 9 and 18 months of age. A reduced size or absence at birth may indicate craniosynostosis or microcephaly. Posterior fontanelle, present at birth, usually closes by 2 months of age. Persistence of the posterior fontanelle suggests underlying conditions such as hydrocephalus or congenital hypothyroidism. Let's next take a look at epidural hematoma. A skull fracture near the pterion can lead to an epidural hematoma due to a torn middle meningeal artery. Rapid unconsciousness and potential death can occur as the bleeding separates the dura from the skull, increasing pressure on the brain. On computed tomography, CT images, an epidural hematoma typically appears as a biconvex, lens-shaped pattern. Let's now look at the picture to the right. Epidural hematoma as seen on a CT scan with overlying skull fracture. Be sure to note the biconvex-shaped collection of blood. There is also bruising with bleeding on the opposite side of the brain. Let's next take a look at the infection of the cavernous sinus. The cavernous sinus is located lateral to the body of the sphenoid bone and sella turcica, forming the lateral wall of the hypophyseal fossa. Related structures. Structures that pass through the sinus. Internal carotid artery and internal carotid plexus. Abducens nerve, cranial nerve 6. Structures on the lateral wall of the sinus. Oculomotor nerve, cranial nerve 3. Trochlear nerve, cranial nerve 4. Alright guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 4-month-old infant is brought to the pediatrician for a routine checkup. On examination, the anterior fontanelle is noticeably small and appears to be closing prematurely. Which of the following conditions is most likely indicated by this finding? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A, craniosynostosis. Premature closure or reduced size of the anterior fontanelle may indicate craniosynostosis, a condition characterized by the premature fusion of one or more cranial sutures. This fusion restricts skull growth in the affected area, leading to abnormal head shape and potential neurological complications. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B, hydrocephalus. Hydrocephalus typically presents with an enlarged head circumference due to excess cerebrospinal fluid accumulation, leading to a bulging and tense anterior fontanelle rather than a small or prematurely closing fontanelle. C, microcephaly. Microcephaly is characterized by a significantly smaller than average head circumference, which is evident on examination, but is not specifically associated with the closure of fontanelles. D, brachycephaly. Brachycephaly refers to a disproportionately wide and short head shape, often caused by premature closure of both coronal sutures. It is not typically associated with the closure of the anterior fontanelle. E, plagiocephaly. Plagiocephaly is characterized by an asymmetrical head shape, often due to positional factors or premature closure of one side of the coronal or lambdoid suture. It is not specifically linked to closure of the anterior fontanelle. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old man is brought to the emergency department following a fall from a ladder. He initially lost consciousness, but has since regained it. However, he complains of a severe headache and dizziness. On examination, his Glasgow Coma Scale score is 14, and he has a palpable hematoma over his right temporal region. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, epidural hematoma. A palpable hematoma over the temporal region, particularly following a head injury, suggests an epidural hematoma. These hematomas often result from a skull fracture near the pterion, leading to a tear in the middle meningeal artery. The classic presentation includes a lucid interval followed by a rapid deterioration of consciousness due to the expanding hematoma, causing compression of the brain. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Subdural hematoma. Subdural hematomas typically occur from tearing of the bridging veins and are more common in older adults or individuals with brain atrophy. They do not typically present with a lucid interval and are less associated with palpable hematomas over the temporal region. C. Intracerebral hemorrhage. Intracerebral hemorrhages involve bleeding directly into the brain tissue and are often associated with hypertension or vascular malformations. They may present with focal neurological deficits, but are less likely to cause a palpable hematoma over the temporal region. D. Subarachnoid hemorrhage. Subarachnoid hemorrhages typically result from rupture of an aneurysm or vascular malformation, leading to blood accumulation in the subarachnoid space. They are often associated with a sudden and severe headache, but do not typically present with a palpable hematoma. E. Cerebral contusion. Cerebral contusions are bruising of brain tissue, typically caused by direct trauma to the head. While they can cause altered consciousness and focal neurological deficits, they are not typically associated with a palpable hematoma over the temporal region. All right, now that we have covered this question, let's move on to look at the next question. A 42-year-old woman presents to the emergency department with a severe headache, double vision, and difficulty moving her eyes. On examination, she has proptosis, bulging of the eyes, ptosis, drooping of the eyelid, and ophthalmoplegia, paralysis of eye muscles. Which of the following conditions is the most likely cause of her symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, infection of the cavernous sinus. The patient's symptoms, including severe headache, ophthalmoplegia, proptosis, and ptosis, are consistent with the clinical presentation of cavernous sinus thrombosis, often caused by a bacterial infection. The cavernous sinus is located lateral to the sella turcica and is a common site for infections to spread from adjacent structures, such as the sinuses or teeth. The resulting inflammation and thrombosis within the sinus can lead to compression of cranial nerves passing through or adjacent to the sinus, resulting in the characteristic symptoms described. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Temporal arteritis. Temporal arteritis typically presents with headache, jaw claudication, and visual disturbances, but is less likely to cause ophthalmoplegia or proptosis. B. Cluster headache. Cluster headaches are characterized by severe unilateral headache, often associated with autonomic symptoms such as lacrimation and nasal congestion, but they do not typically cause ophthalmoplegia, proptosis, or ptosis. C. Migraine with aura. Migraines with aura can cause visual disturbances, but they do not typically present with ophthalmoplegia, proptosis, or ptosis as described in this patient. E. Acute angle closure glaucoma. Acute angle closure glaucoma presents with severe eye pain, blurred vision, and halos around lights, but it does not typically cause ophthalmoplegia, proptosis, or ptosis. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.